Welcome back. If your child is struggling with a neurological condition, so many things can seem impossible. Finding the right treatment, living without pain, or hitting developmental milestones. At Helen DeVos Children's Hospital, doctors specialize in the impossible, and the Robust Neurosciences program, ranked one of the best in the nation by U.S. News and World Report, their mission is to help you and your child overcome the challenges that seem impossible. You know, at some point in their lifetime, 1 in 26 people will have epilepsy. Here to tell us more about the top-of-the-line epilepsy care and how his team treats it is pediatric neurologist and epileptologist. Did I say it right, Dr. DeVries?
Yeah, you got it.
Nailed it. Is a big word. Thank you, doctor, for joining us this morning. Hey, let's start with just a definition. Epilepsy. Can you explain what it is to those who may not be familiar?
Yeah, that's a great question. I think before talking about what is the definition of epilepsy, it's important to understand what is a seizure. Now, a seizure is that physical manifestation that would happen during an abnormal, excessive discharges that occur in the brain. And so knowing what a seizure is, we can understand what is epilepsy, because the definition of epilepsy is when a person has experienced 2 or more seizures within a span of 2 years of their lives. That's it. That's all it takes for a person to have epilepsy, is if they have had 2 or more seizures, or if they've had 1 seizure with an abnormal EEG or an abnormal MRI brain imaging that would indicate a risk for more seizures.
So we're getting these discharges, these surplus, if you will, discharges from the brain causing these seizures. I'm assuming as a parent, and for any parent out there, if you were to see your child suffering from something like this, it's just got to, put a great amount of fear in you of the unknown. What do you do for children with epilepsy?
Yeah, so, I think it's important to understand that, hey, okay, your child had a seizure. Your child has now been diagnosed with epilepsy. You know what? Hey, it's just epilepsy. Most people with epilepsy go on to live very fulfilling, wonderful lives. And that's one of the most important things that I want to express to my patients and to my families, is for them to understand that having epilepsy is not a life-changing event. It is not defining our patients' lives. There are lots of people in this world that have epilepsy. As you mentioned earlier, 1 in 26 people in the United States will have a history of epilepsy at some point in their lives. That's a lot of people. That is a lot of people. That's essentially, that's 1 child in every classroom will have a history of epilepsy at some point. And again, most people with epilepsy are very, very well controlled and very successful and living wonderful, fulfilling, fantastic lives. It's that small group of patients that we really want to kind of dig in and provide that extra pursuit of what can we do for them.
We know that epilepsy is treated with medicine that helps control these seizures. What happens when those medicines don't work? Is there another treatment?
Yeah, that's a great question. For the most part, medicine works very well for our patients. 75% of our patients with epilepsy will respond to that first or that second medication that we prescribe for them. That means only about 25% of our patients are struggling with what we refer to as medication-resistant epilepsy. And for those patients, we do have a lot of options. We have a lot of opportunities for treatment for them. Generally speaking, we investigate those particular medication-resistant epilepsies in a variety of ways. We can pursue further investigation with getting continuous long-term EEG monitoring, where we measure the EEG activity, the brainwave activity, for days at a time to collect that information and capture the seizures. We can pursue additional brain imaging, which would include an MRI or a PET scan to measure metabolic activity in the brain. We can do imaging that can identify what blood flow looks like in the brain during a seizure. And one very important piece of technology that we have at Helen DeVos Children's Hospital is the Magnetoencephalogram, or the MEG, which measures not only the electrical activity in the brain, but it can also measure the magnetic discharges that the brain produces during a seizure or in between seizures. And that can help us identify where are the seizures coming from. That's a very exciting little piece of technology that we have, because, quite frankly, very few institutions have this magnetoencephalogram across the country, and so we're very excited to be able to provide that opportunity for our patients. All in all, when we look at all of that information that we're collecting for our patients, that can help guide us towards what other options do we have besides medicine. We can look at various options for our patients. And, in general, I like to look at it as basically 3 different choices for our patients. One option that's not medicine or non-pharmacological would be to look at what dietary adjustments can we make. And we do that very, very rigorously with a pediatric registered dietitian and with the neurologist, monitoring labs and adjusting the diet accordingly. Additionally, we can look, another option is what we call neurostimulation, which is essentially, I like to think of it like a pacemaker for the brain, where we can monitor, or we can provide a device that is able to send an electrical pulse, an electrical signal or stimulation into the brain, which can reduce the frequency and severity of a seizure, which is pretty cool. It's a very, very exciting piece of technology that we can provide. And the third option that we do have for our patients with medication-resistant epilepsy is surgery. We work with our neurosurgeons to identify where are the seizures coming from and whether or not it would be safe to actually remove or alter or disrupt that signal and disconnect that portion of the brain that is causing those seizures.
Oh, amazing stuff. And of course, it's so wonderful to have this right in our own backyard with one of the best children's hospitals in the world. Dr. DeVries, thank you so much for the time this morning.
Oh, my pleasure. Absolutely.
Thank you for that information. You want to learn more about pediatric epilepsy or Helen DeVos Children's Hospital? It's pretty easy. Just head online to spectrumhealth.org. We'll be right back.